had the pleasure of working alongside Deirdre as a mum with lived experience, and she has been such a champion to make sure that these services now are becoming available, and is working away behind the scenes in so many different ways. And we are all hugely thankful to her for the work that she has done and the work that she's continuing to do. And so this is a very exciting presentation she's going to do us, because you've heard most of us say all day how excited we are about the fact that these teams are coming. Well, Deirdre is going to tell us what's next and how and where we're going with it all. So Deirdre's already shared her screen, so I am going to hand over to her, and then if there's a bit of time at the end, then we'll have a bit of a chat and some questions. So Deirdre, thank you, and the floor is yours.
Thank you so much, Lindsay, and good afternoon, everybody. And I hope you're really having a good conference so far. And I am absolutely delighted to be able to tell you a little bit about the community specialist perinatal teams and what our other plans are for the future. Oh, I can't. My slide's not moving, Lindsay?
Yes, I can.
Yeah.
Yeah, it's just maybe a bit.
Okay, are you controlling that, or is it me?
No, it's you. I just wonder if maybe it's a wee bit, the system's a wee bit slow. So
okay, lovely. Well, just to start with, I thought it would be useful to pull together our thoughts and I suppose all the work that we've done so far to look at our sort of shared vision for perinatal mental health services. Because you've been so patient and waited so long for these services to materialise, we want to make sure we have the best, and we're looking to develop high quality perinatal mental health services. And these services we want and value to be shaped around mothers and their families and their needs. But we also recognise that we need a whole system approach, that we need to provide services and responses and interventions and support from the very mild episodes of illness right through to much more complex episodes of illness, and bring mothers through the recovery stage and to the well-being stage. And we want to make sure and promise you that there be a clear focus on service improvement, that with everything that we do and every part of the service we implement, we will be studying it and looking to see how we can do things better. We also have, over the past few years, been developing a lot of training programs. So we want to develop and make sure that we have a community of well-trained staff. So no matter what part of the service you meet people at, that they will have a really good, well-developed understanding of perinatal mental health services and how they work and what part of the system is best suited to your needs. And this will include having to strengthen our universal services. And by I mean universal services, I'm talking about our GPs, our midwives, our health visitors, the treatment room nurses, the people that you meet more frequently in your experience of health. And so that we want to strengthen their understanding and their involvement in perinatal mental health services. And also we know that there's such fantastic primary, secondary and third, our community and voluntary sectors working in this area. So we want to network and connect all and strengthen our relationships, which, you know, as this conference is testimony today to the numbers of different people that are interested in this area. So this is part of the work that we want to do, is to bring us all together. We also hope to develop a regional service, a regional network that brings people together in communities of practice, so that we you know, develop and encourage people to be involved and to develop our services and to make the service in Northern Ireland world class. So our background and how did we get to today? Well, as I said, there was some very, very passionate people, both from different professions and service users, people with lived experience, that have actually made this happen. We've had community and voluntary sector organisations that have been passionate about keeping this on the agenda. And I think the combination of both the professional colleges, some very committed women with lived experience, and some very committed community and voluntary sector, we are where we are today, because they kept relentlessly knocking at doors, keeping this issue on the agenda. And even during times where I suppose government and the political context weren't right, they never let it slip. It always kept it on the agenda and kept motivated in times that I think could have been quite challenging. I suppose one of the reasons that we probably haven't in Northern Ireland got specialist services to date is that most of our mental health services are very general in their approach. So we haven't, in the development of mental health services, ever had sort of specialist teams. So this is fairly new to us to have this sort of approach of a specialist perinatal mental health team. However, there was a small team established roughly about 13 to 15 years ago in the Belfast Trust. And that has given us our prototype that we know that makes a difference to mums and their families' lives. And this is what we wanted access for everyone in Northern Ireland. As you know, I was involved in the RQIA review, which reviewed our services for perinatal mental health in Northern Ireland in 2016 and 17. And it was no great surprise that actually there was so many recommendations of services that need to be brought forward. And we set up a regional group of, again, probably reflected the people that had spent years lobbying and advocating for this service, but also we involved trusts and professional groups and unions, professional organisations. So it was an extremely large group that were formed to take this forward. This year, or in 2020, actually last year, the Mental Health Action Plan was released by the Minister, and there was our golden nugget. We got the first sign that actually perinatal mental health services were being built into policy here, and that we were to receive the funding for the regional service and for the community teams. And so we have received our financial allocation letter in January this year. As I said, as Lindsay said at the beginning, I work at the Public Health Agency, so we're sort of involved with the setting and establishing of the services and taking the sort of and working with the trusts to set up new teams. So just although we're developing services for, I suppose, a more severe complex side of the illness, just to reassure people that we haven't lost sight of the fact that the service needs to provide services that respond both to women with mild mental health difficulties right up to the severe and complex. And I suppose as a planner, I like to think of numbers and like to visualize what the size of service looks like. As you know, we have normally about 23,000 births in Northern Ireland per year. So if you can consider that probably 1 in 5 women will develop some sort of form of minor mental health difficulty in the postnatal period. And sometimes that can develop in the antenatal period as well. And we reckon that about 1 in 10 women will have about a moderate experience of this illness as well. And then that means, and we also plan towards probably about 120 women are at risk of having severe or complex mental health illness. This is where we feel that the community mental health service, community perinatal, will respond to this group of women. But we also have to plan for services around the whole experience. So to me, it's sort of like a pyramid, where the universal wide service at the beginning for the mild experience of illness, we need to build and strengthen our community and voluntary supports, our peer-to-peer supports, and of course the important role that family and friends play in that. Then as we move on to the more sort of moderate experience of illness, primary care, community care, and our teams there. But we also need to develop short-term interventions that respond and help mums and their families cope better with this experience of illness. And then as we're moving into the more severe and complex side of the illness, that's where we now have our Muller and our community specialist teams. And also we need to develop parent and infant services. And we haven't forgotten that we do need to look at the provision of our mother and baby unit or centre, as some places have called them now. So we're we realise that there's a spectrum of things that we need to develop, and we're probably starting at the top of the iceberg, but we will not forget that we need to develop the infrastructure and the foundations below to make sure that all levels of our support are available. For our community specialist perinatal mental health teams, we have quite a large number of people involved in this. And I suppose just to say that there will be, depending on the nature of your illness, will depend on who you actually meet as part of the team. The team will be, there will be the same team in each trust area, and they will be made up of the same combination of different professions. And we also have some peer support built in, and we also child and parental interaction and psychology built in. We have psychiatrists, nurses, social worker, nursery nurses, occupational therapists, and also specialist roles in terms of midwives and health visitors to support the mother and family at this time. So each team will look roughly the same. There might be some slight changes, but we wanted everyone in Northern Ireland to have access to the same type of service. And we hopefully will develop these services in unison together. So that's what it looks like at this moment in time. But as I said, we're committed to service improvement methodology. And when we develop these teams, we will match it to the needs of the women and the mothers and the families and what is being presented. So how are we taking this forward? I'm sorry, but at this stage, it gets into the real business side of the house, okay? So there's lots, if you can imagine, starting up a new service has lots of very practical elements to it, like business cases and funding and computers and desks and venues so there is a lot of sort of about 6 months of recruitment that needs to go on, premises that need to be secured and whatever. So we have supported this through an implementation structure, and we're using a methodology called NERN, which has regional implementation groups and also local implementation groups, and we take it through an implementation methodology. So who's on these groups? On the regional group, we have, of course, the most important person to us at the beginning is having representative of a person with lived experience, and that's Lindsay on our regional group. We also have the 5 chairs of the local groups, so they will be able to feed back to us on their progress with implementation and also take forward any issues that need to be implemented from a regional point of view. We will also have strong representative from the community and voluntary sector. And we also, as well as having the trust assistant directors and chairs of the local implementation, we do also have professional representatives, because we not only have to think of this in terms of local teams, but we have to think of it in terms of what actually the person or the member of staff is bringing to the programme. And so we need to develop the sort of professional competencies and to deliver the service. The PHA, which is myself and my representative from, and also the board, which does the finance and social care and planning part of the process, are also sitting around the table at the implementation group. And we have been meeting monthly since January, just to really keep the emphasis on the progress to date and keep together, so that when we're implementing this, that we troubleshoot issues and problems together, and we can then report and progress on as well. So what have we been doing so far? Well, apart from I've told you we have developed a business case, which was a regional business case. Now that has to be translated into local trust business cases, and the finances and the funding locally will have to be agreed and signed off. We have been doing a lot of training, and we want to make sure that that continues on a regional structure. And we have a competency framework, which we are finishing off. And we need to ensure over the last 2 or 3 years, we've been very fortunate to get small amounts of funding, which has allowed us to do quite a bit of training, but we need to continue with that because staff change all the time. So you need to have a continuous program of perinatal mental health training so that new people are skilled up. We also need to, as you can imagine, we need to measure the impact the service is having and look at the outcomes as well. So we want to have from the very beginning, plan to the very beginning to look at how we can measure the difference that this is making to people's lives and the different experience that mothers and families are having now compared to maybe some of the past experiences. And we also want to make sure that both this is high on a quality improvement and research, that we are making sure that we're taking things through very carefully, thoughtfully, and based on the best evidence available. So it'll be part of the regional group's responsibility to make sure that pieces of research, and we make sure that we study and promote a culture of evidence-based practice within the teams. But we continue to connect with our other nations, leaders and specialist teams in other parts of the UK. They've been so helpful to us so far at helping us sort of learn from their experience and to incorporate the really good parts into our experience of developing teams. And they've also been very good about sharing resources and materials for the teams as well. And we've been able to develop a lot of our own resources to take forward to help with the implementation of the teams. So we have one regional group, and then at each trust level, we have 5 local implementation teams, which are called LITs. And again, the chairperson of that, who reports to the regional group, is the Assistant Director of Mental Health within the trust. And they would be what we call the provider lead, the person that is responsible for making this happen. But I can't emphasize the most important person on the group is the person with lived experience. And we hope that at this stage, we have one representative on each group locally. And we also have local and community and the voluntary sector, community and voluntary sector also represented in this group. But the success of this locally is a combination of maternal, child health and mental health services together. So we need to bring together groups of staff that are working in both of these areas and bring this together to a think family organisation that is responsive locally to bringing forward the perinatal mental health services. So that's what our local teams, and it has taken, I suppose, a wee bit of time. Some of them had formed and had meetings very quickly. Others took a wee bit of time to form the right people around the table. But we now can report that all these teams locally have met. So what are their responsibilities when they need to implement the business case, the local business case, that the aspects of it, they need to implement all that, and they will have the funding and they will be held to account for the implementation. They also need to project manage the new service. As I said, there's all sorts of aspects about pulling a new team together and making sure that you recruit and have people in a base and it all works out well. Ensure that the individuals that we involve in all aspects of the plan and implementation of the local service, that we're involving people with lived experience along that journey so that they can help us shape and tell us what works, what doesn't work for them. And then hopefully that will bring us to a more local action plan. But there's lots of communication that needs to happen with local people and local organisations, and both perinatal and mental health services are quite large services. So the best we can do is develop the relationships and communication in terms of it, and that'll be very much the important role for the local groups to do. So our progress to date is At the minute, we are, have received our funding allocation, and we are busily working through the business case with the trusts. That will allow them to move to the recruitment of the teams. So you will probably see a flurry of ads arriving all over the place when the teams are go to paper and press in terms of recruitment. But we still have been working on implementation guidance for the new teams. Over the last few years, anything that that we thought might be useful, we did think and work on together, and we pulled together sort of implementation guidance for the new teams, including referral criteria. Of course, this all has to be ratified by the local group and tested and implemented and considered and reflected on and that. But it's just a starter for 10 to get all the groups and the teams in place, and for us to have something to work on. It's a blueprint, but it's a blueprint that can be developed and changed and added to. From the beginning, we will implement the services to meet the quality standards of all the professional colleges, and we have been considering this through the whole journey, and I think that we are well versed in terms of the expectations about what a good quality high perinatal mental health service is. So we will from the beginning ensure that we are implementing to make sure that we meet these standards. We will finish off the training competencies and make sure that there is a healthy training program in place for the next year. And we've also started to make initial connections with the infant mental health framework, because we can really see the benefits of these two pieces of work coming together, and about us working jointly together in taking forward. And both both pieces of work are now coming together, and the initial connections and wiring has begun to happen. So what's next for the future? Well, we want to make these teams the best we can. That's certainly our priority at the minute, both the regional service and the community specialist teams. That's certainly our key priority for the next year. We want to make sure that we link with the community voluntary sector and the peer support networks, and we get that right and bring it all together. We also want to develop a real quality improvement approach to making sure that we have world-class services, and that we're developing the best services we can. And not to forget that there's still a business case that needs to be developed for the mother and baby unit. And that will be certainly within the next 6 to 12 months will be a key part of my work taken forward. I've just put my name at the back if anybody wants to give me, if it wants to get in contact with me, on my mobile numbers there. I mightn't, I will get back to you sometime, but and I encourage you all, if you do want to connect with me, please do. So thank you very much for listening to me. I'm sure one or two people will have questions on the back of that, and hopefully I'll be able to answer them.
Thank you very much, Deirdre. That was absolutely brilliant, with lots of really exciting information and details around what's to come. Really encouraging to hear about the infant mental health link between that and perinatal mental health, because I know that's something lots of us have been talking about for a long time. So that's brilliant. And I also know the community and voluntary sector will be delighted to see themselves getting a mention, and the mother and baby unit, and lots of comments coming in there about how great that was. We do have a question, and it's a really important question. It's quite a detailed question. I know you can't maybe,
that's fine.
You can't maybe see the question and answer to be able to read it. Catherine's kindly sent it through, so it's in 4 parts, but it's really around the pregnancy and loss care pathway, which was published in February of last year. So I don't know whether you had any work to do in that, but her question is really around specialist perinatal mental health service in the trust. Will bereaved mothers be referred into these services, or do they sit outside this model? So I don't know whether you want to reflect something in that, and then maybe there's quite a lot of other questions within that. It might be helpful as well if Catherine was able to email you for more of that, but if you could say something to start with, that'd be great.
Catherine, we do recognise that this is an issue that we're going to have to work through. As you can see with our perinatal mental health teams, we have quite a number of different professions involved. And I think that this is something that we will need to consider, because at the minute, you know, we're that might be best serviced by some of our maybe psychologists and midwifery colleagues, mental health colleagues within the team. I'm just surmising they might be the natural fit for that. And so those are the things that we need to work through and to look at and to provide a service for where we feel the need is, and there's no doubt that there is need here. And so I think what I can say to you at the beginning is that we will work through that. We will, you know, consider the pregnancy loss. So I know that one of the public health consultants was working on the recurrent pregnancy loss pathway, and Catherine has discussed that with me, and we did put it as something that probably needs, when the teams are in place, to be given more consideration and a regional response to that. The other that probably is around that is around the loss of a still, you know, a later pregnancy death as well, and with that, the pathways around that need to be revised, and I've given a commitment to do that this year as well, and that will have to be built into response here as well. So it will be considered, and we will work out the right pathway and the right response to it. And those are the things that we need to, I suppose, that's where we need the regional team in place for us to work out what's the right thing to respond to that, to the particular needs of that group of women, and respond to it. And you know, as I say, that was in the evolution of the teams. That's why we had such a wide range of different professionals on, so that we knew that we could, you know, sort of have a wider response to some of these issues. Yeah.
Thank you, Deirdre, and thank you, Catherine, for that question. Deirdre, if you don't mind sharing your slideshow, then everybody will be able to see the two of us just for a minute or two.
Oh, hi. Yeah, sorry about that. Apologies.
So yes, Catherine, thank you so much for putting in that question, and I know that if you need to discuss that further with Deirdre, you can, but thank you for asking that. I think we probably have time for just one more, and there are a few others in there, but there's one here that came up that I thought would be good just to get your take on, and it's from Kira, and who says, in the absence of a mother and baby unit in Northern Ireland, will care of the most severely unwell mothers sit within the community perinatal teams or within the mainstream mental health services?
I think the community perinatal mental health teams will certainly have a significant lead in that. But I know that we will probably need some inpatient provision. So I think that we will be reliant at this moment in time on our existing facilities, which we have done a piece of work. One of the recommendations of the RQIA, that we would make those environments more family friendly, which has been carried out, but I think it's probably going to be a little bit of a hybrid model in the interim. I'm interested also in Wales, because they have taken a stepped approach. They opened an interim mother and baby unit this week, or a few weeks ago, and their still plans are to you know, move to a more purpose-built mother and baby unit. And I think that that's maybe something that we might need to consider, in terms of it might be a more timely response. But I think at the minute we will still require to use our general mental health facilities, but that the mother will be strongly supported by the community perinatal mental health team. Again, that's something that needs to be worked through in terms of you know, the sort of networks and relationships and how we manage that. And I'm sure our lead perinatal psychiatrists will have a very strong input into what's the best thing to do for parents.
Thank you, Deirdre. Thank you very much for all of that. I think some people have been asking if we were able to share some of the slides that have gone with presentations. So I think probably people will be very keen to get yours because there was an awful lot of really important information in that. There
Sure.
are probably a few more questions, so people might get in touch with you at some other time to ask those.
Okay.
Because, we are a little bit.
Do you email, if you email them into me, I will get back to you with answers. Yeah, please do, you know, and I'll respond to you.
Thank you.
Unfortunately, I'll not be sharing them with others, but you know, I'm very happy to take individual responses.
Thank you. So Deirdre's email will be on the PowerPoint presentation that she
Yeah.
will be able to send out. So you'll be able to find it and to email her. So Deirdre, a huge thank you again
Thank
for
you.
taking time out of your day and your week, because I know you've been conferencing quite a bit this week to share. We really do appreciate you coming to join us. So thank you for that.
It's lovely to have some good news to report.
Isn't it?
And hopefully at next year's conference will be our teams will be presenting.
Absolutely.
Yeah.
So just for our delegates today, I'm going to end this session and I will go in to start and host another one. We have two coming up simultaneously, so you should have picked already which you want to go to. If you haven't, give us an email and we'll help you to do that. So the next two sessions are either birth trauma with Anne-Marie McKinley or the value of perinatal peer support with Rosie from PND and me. So go and have a look and see which one you've signed up to and click on that link, and either Michelle or I will see you in that Zoom room in just a minute. But thank you again, Deirdre, and see you all soon. Thank you.
Hi, everybody.